Welcome, everybody. My name is Pam Rice. I am the Director of Member Engagement at ACA. I am a social worker as well. Welcome to this evening's forum. This is a special forum for our new members. The presentation will explore 90 days of a member's journey at ACA after they are enrolled for care management services. So hopefully everybody on this presentation fits into that criteria. The agenda includes an overview of ACA, care coordination services, specifically how your care manager can help you achieve the goals you have set for yourself or your loved one, what to expect in the first 3 months after enrolling into ACA, a review of the HCBS waiver application process, what care managers can do for you, what care managers need from you, and a brief overview of OPWDD programs and services. So hopefully that is appealing and makes sense to everybody. So again, glad to see everybody here. I just want to put a quick plug in for our website, as some of my colleagues know that I always do. It is full of webinars, and especially for everyone here who might be new, it's really worth your time to go to our website. It's www.acany.org. So please feel free to take a look at it. It's full of information. We especially have a calendar page that has some information on webinars and meetings to attend that could be helpful to you. So we have a wonderful presentation today. We have Megan Porter and Chrissy Bryant. First, I would like to introduce Megan. She's actually our host here. I think, in terms of what I see on here. Megan is the assistant director for provider relations at ACA and has been in this role since October of last year. She has been with us at ACA since July 2019. Prior to this role, she was an eligibility coordinator, which is someone who knows a heck of a lot about benefits and entitlements, and supported the care management and admissions departments with navigating Medicaid and other benefit programs. Megan earned her bachelor's degree in psychology from the University of North Carolina at Greensboro and has spent the last 9 years working in various OPWDD funded programs, including residential services, Medicaid service coordination, and the like. She lives on Long Island with her family, dog, and 2 cats. We also have Chrissy Bryant, who is ACA's outreach coordinator and has been with us since October of 2018. Prior to this role, she was a care manager and supervisor in our admissions department for the Long Island region, supporting families through the intake and enrollment process. She earned her bachelor's degree in psychology and a master's degree in human resource management from Stony Brook University, and has spent the last 25 years working in various OPWDD funded programs, including residential, clinical services, and Medicaid service coordination. So with that, the presentation should last about 25 to 30 minutes. Everyone attending that is listening will be on mute if that's okay, and unable to speak. I think you do have control to unmute yourself, but if everybody could keep themselves on mute to the end of the presentation, that would be very helpful. It'll help keep the flow of the presentation on target with our timeframes. The chat box is open for the entire duration of the presentation. We will respond to any questions in the chat box at the end of the presentation, just to, again, keep that flow. If you would like a copy of the presentation, please put your email address and full name in the chat box if you'd like a copy of the PowerPoint today or tomorrow. We do plan on recording the session. If you're not comfortable with that and do not want to be recorded, I can touch base with you after the presentation and provide material to you. You do not have to stay for the entire presentation. We also have language transcription services available. You will see an icon at the bottom left of your screen. Once you click onto that icon, there will be a drop-down menu, and you will have the ability to select your preferred language. The transcript of the presentation will then come up for you in that preferred language. If you have any problems, please, you can relay that information in the chat box. I think that is it. So with that, I'm going to start with Megan, or I don't know if Chrissy's going to start.
Chrissy's going to take over. Can everybody see the presentation? I just want to make sure. Yes?
Yeah.
Okay, great. All right.
Thank you, Megan.
You could do the next slide. Hi, everybody, and welcome to ACA NY. As you know, AC is one of the CCOs, or care coordination organizations, that provide you with your dedicated care manager. So we're happy to have you all here, and we're happy you've come, this far along, because we know it could be a little bit overwhelming. So we're glad you're here. Some of the things your care manager will be able to do for you includes creating a life plan with you, with your input. They help find and coordinate OPWDD services, and they link you to community programs. Care manager will also help coordinate your healthcare and behavioral health services and help you apply for and maintain benefits and entitlements. So ACA does provide care management across New York City, Long Island, and the Lower Hudson Valley. We're currently serving about 25,000 people. And we match you with a care manager who also lives in your region and knows your community well. I'm sure throughout this whole process, you've come across many acronyms and terms that get confusing. Our website does have a comprehensive list of acronyms listed there that you can download, or we can send to you via PDF if easier. But these are just a few of the ones you'll be hearing in the next few months. An LP, or a life plan, is the comprehensive plan, which will be planned with your care manager to be completed by the end of your 90-day from enrollment. So this is the meeting that you'll have with, whether it be, if you have service providers yet, or your care manager or school, or whoever you want invited to this, to discuss your needs and goals. So this life plan is created with you, with your input and your circle of support. The PATHS assessment is something new. Our initial assessment used to be called the IM, if that was familiar to you, but it's now called the PATHS, which is the Personal Assessment Tool for Health and Services. This is the personalized planning tool that helps build your life plan. So this will be done prior to your life plan. It is updated every year. But right now, this is like the main big assessment that's done right before your life plan. The DDP2 might be familiar to you. The Front Door has done this before with families. It's the Developmental Disabilities Profile. This assessment tool is used to provide an accurate description of your skills and challenges. This helps the care manager also identify some goals or service needs, and it's completed right now every 2 years. The HCBS waiver is the home and community-based waiver services. Sometimes it's called waiver, we're applying for waiver, we need the waiver service. HCBS, it's sometimes called. So this is the services that once you do your PATHS assessment, you'll do your DDP2, you'll do your PATHS assessment, you'll get that life plan published, and then we'll start to apply for that waiver service. Those are the services that are paid for by Medicaid, and it allows you to receive these Medicaid funded services at home and in the community. So you'll hear that word a lot. The NOD is also used often. The notice of decision is something that you have already received when you got eligibility. So that's the notice of decision letter. But you'll also get one once you're approved for the waiver or Medicaid as well. So sometimes you'll hear NOD. If you have those letters and they come in the mail, just please save them, keep them aside. Sometimes programs that you're interested in will ask for them. The care manager can load it into your file as well. The SARF is something that you'll hear in the future. It's the service amendment request form. So your care manager will submit this to OPWDD if you're looking for a new service or a change in approved hours of a service. So this is once you have that waiver service, if you're looking to increase those hours or change a service, this SARF is what needs to be submitted by the care manager to OPWDD for approval. And like I said, there is this comprehensive list of acronyms right on our website. You can download it for a PDF. If you want a copy, we can also send that to you as well. So ways your care manager can help you. There you go. They'll identify the OPWDD programs that will help you work towards the life plan goals. They'll help you tour them, they'll help you find them and enroll you into them. The care manager will also be the one to provide information about non-OPWDD supports and services. So not everything has to be OPWDD related. Like we said, a care manager is assigned to you by your location. So they might be aware of different programs out there, such as the YMCA or the library, or local colleges have a lot of classes, things like that, sporting clubs and things like that. They'll be able to connect you to as well. They're also there to support you through different life transitions. That could be from going from elementary school to middle school to high school, then aging out. All those different transitions, things are more available. As the child gets older, things are more available to them. So the care manager will help you navigate that. They can also help you through changes in housing or a loss of a caregiver, amongst others. They'll also ensure you receive appropriate health care. They can help coordinate doctor's appointments. They can help coordinate discharges from the hospital. Sometimes you can't leave the hospital till, say, you have physical therapy in place. They can help coordinate that. They could help find specialists for you. They can help make sure that medication is ready for pickup when you discharge as well. The care manager also assists with assessing and maintaining benefits such as Medicaid, SNAP, HEAP benefits, and they'll help you navigate programs such as Social Security. Through the pandemic, a lot of these research and stuff have changed, so the care manager will be able to get support from our benefit department to see what's changed, what can not have to be researched till next year. There's always updates happening, so we have first knowledge of that as well. So ways you can help your care manager: maintaining regular communication is key. So speaking to your care manager at least every month, even more, meeting face-to-face as required by OPWDD. Currently, we are in a public health emergency still till July, I believe, mid-July. So a lot of the visits are virtual, and a lot of the visits can continue to be virtual after that as well, but it'll be a blend of in-person. Sometimes they'll see the member at the house, or maybe at their school, or maybe at their day program. But there are required face-to-face visits that the care manager has to do, and they're there to help you. So the more communication, the more they get to know you and see what's out there for you. Also be proactive. Tell your care manager as soon as possible when there's any change in services or you're looking to apply for new programs. Just to be transparent, a lot of things are taking a lot, lengthy amount of time. So the earlier you want to look into something, the better, because right now, and usually, things in this world take a long time. So just the quicker something, the better to reach out to them. Talk to your care manager if you're happy with your services. Just because you're in something or you have some type of support or service doesn't mean you're stuck there. If you want to change something, or you feel like you've met your needs there and you're looking for something else, just communicate that. Tell your care manager right away if there's any changes in your health. They're there to help you, especially if you're hospitalized or if you've had any type of emergency situation. The more knowledge that they have, the better off they'll be able to tell you. We have a great networking system, even just within the care managers at ACA. So if it's something they're not able to know right away, they can find out, and find the resources that you need. Always tell your care manager about any notices you receive from Medicaid, Social Security, any type of entitlement program. Letters will come, and usually the letters will say, we need to redetermine this by the next 10 days. Like, they give you very short windows. So as quick as you can open it, let us know, scan it over to us. We can see if we can get an extension. We can help you get what they need. So always keep them informed with that.
I'm sorry, my computer's being a little bit laggy right now.
It's a little slow. Yeah.
It's being a little slow.
These are just a few of the testimonials from families regarding care managers in action. Like I said, we have those core services care managers are supposed to help you with, but there's so many little things that a care manager can do that really can't just be listed on a slide. So these are just some of the testimonials we've had in the past. There was a care manager that had a person, under their care for years and years. When her aunt or this person's mom passed away, the family member couldn't believe how much the care manager actually did for them, because you don't realize until they're the one now taking over. So they were just really, really happy, and said that their aunt is a challenging person. So they really won the lottery with this care manager, Latasha. Also during the pandemic, we had a lot of care managers that were able to get appointments for people that were, like close to their location. They didn't have to drive upstate to get a vaccination. They were able to help get an iPad so somebody can participate remotely in their day program, as well as FaceTime with their family members. Also during the pandemic, we had people that were able to find new homes that were closer to proximity of their families. So there's a lot of little things that are also done by care managers, and during the pandemic was really, they really hung in there and got creative and were able to get a lot of things done. Okay. So what to expect in the first 3 months? The first month, you should be getting a introduction call from your care manager. They'll kind of introduce themselves. They'll, share contact information, start to schedule some of those appointments. Some families like to schedule everything at once in the next 90 days. Some like to, take it month by month. They'll have like an initial face-to-face meeting, can be done virtual, like I said. They'll have that DDP2 assessment completed and a care manager checklist. And then they'll start to probably discuss the next couple of months, which is that path assessment that I said was coming up, as well as scheduling the life plan. It usually shouldn't be done the same day because they are pretty lengthy, the two of them together. But it could be done the same month as well. Just the life plan has to be published within the first 90 days. So it kind of, you have that flexibility in there. The second month, you can complete that paths assessment with the care manager, start to schedule that life plan meeting, discuss what services are out there. You could start to look, explore, see what's out there. A lot of the programs or supports are doing some in-person tours. A lot of them are doing virtual tours, which is great, just to see an overview of it quick. You can do more at once. And they'll begin to start that waiver application, which is just some paperwork, filling out the services you want. Third month, getting that life plan done. Family member has to approve it as well, sign off on it for it to be valid, and published. Once you do have providers or waiver providers or supports, that life plan does get published and distributed to everybody, including the member. And then they'll submit that waiver application to OPWDD. OPWDD reviewing that waiver application, there is no real time frame in that. So just to be transparent with that as well, they do say within 90 days, but they'll say it from when they're looking at it on their desk, 90 days. But as long as, everything's there, the life plan's done, everything's gone, they've been getting through it a little bit quicker. So this is what to expect during the waiver application. Items needed: you need to have active Medicaid through the local district, which the care manager can assist you with. It must include community-based long-term care coverage, which is usually done for enrollment, but if not, this can be completed after. We do have a benefit team within that helps in our admissions department within our agency that helps guide everybody through this. The level of care determination is also submitted with the waiver, which is the documents that you already had to enroll, which is that psychological, the psychosocial, the medical. Part of the waiver documentation is the request for service authorization. It's just a form, just saying what services you're interested in. If you're looking for community rehabilitation staff, how many hours, do you want 10 hours a week because, the member's in school full time, or do you need 20 hours? You're looking for hours on weekends. That's where all this kind of information is filled in. The life plan is also included in that waiver application, as well as an application form with demographics and documentation of choices, which just shows OPWDD that you're working with ACA Care Management for this waiver. These are some of the supports and services that you will look into. I know a lot of people are very interested in self-direction. We do have forums and parent workshops, like Pam was saying, each month, and some of them do involve self-direction. If you're interested in that, you could, your care manager could start to send you a list of brokers. That would be the next step, finding a broker and attending OPWDD's self-direction info session. That info session is mandatory if you're interested in self-direction, but it's a good option for support and service. Some of the day services are some of the services families could be interested in, which could be the day rehabilitation, which is similar to like school setting. They have Program Without Walls. They also have, community rehabilitation staff. You could do a mix of them. You could do part-time of one, part-time of the other. Some of the supports also include residential settings, which could include apartments, shared living, housing, group homes, some housing subsidies. These can also be built into your self-direction budget, or it could be separate as listed here. A lot of employment services are options as well, whether you're looking for job coaching or pre-vote to find out what kind of job you might be interested in. You could have staffing help apply for, apply for different jobs, or just help you in your current job. Respite is also a waiver service, home-based or site-based respite. Respite has a lot of options built in there, along with family support services. That could be like parent work groups. It could be, town activities or voucher reimbursements, as well as environmental modifications is another waiver service, whether you're looking for a van modification or you need a ramp into your house or a door widens in your home. The care manager can help you apply for that as well. Adaptive technology is also something that could be something like a communication device or a special headset that works with a computer, especially everything's been virtual lately. So that's been an increase in that, the technology piece. CSIDD is also a waiver service. It used to be called New York Start. So this is behavioral supports for crisis situations, or services that can help create behavior plans and work with your team to help in behavioral issues. Family support services are something that you are eligible for now before waiver is approved. So once you have that eligibility, what you do, because you're here with care management, you can receive these family support services while you're waiting for the waiver service, because you're already CC enrolled, you already have Medicaid. So you can ask your care manager for a copy of the family support guide if you don't have it already. We do have them saved on our website as well per region, because each region has their own. There's a variety of things in there that you can utilize that kind of just, is a place filler until that waiver service is approved. There's family reimbursements. So if you're looking for camps and, babysitting, or some health copays are included in there, you can be reimbursed right now up to $1,000 a year. There's a section in the family support guide that tells you which provider agencies do accept applications. There's several of them. I think that's actually going to be increasing the amount but I think more closer to July or so. But that's like a great opportunity to use now until you have your actual service in place, especially with the summer coming. It'll do like camps, activities, anything like that you can be reimbursed for. Some adaptive technologies also can be reimbursed. The environmental modification is in there as well. On top of advocacy services, respites, it could be like an in-home staff respite, after school respites, weekend, overnights, recreational activities, camps, like I said, there's like sibling support groups, parent support groups. There's like a variety of things in each packet. Additional resources that you can use. Parent to Parent is an amazing group that you can sign up for emails. It's by region as well. There's multiple emails a week of different activities that are going out, different workshops. We'll post our workshops on there as well, and they'll do a big email blast. There's really great opportunities. I would definitely sign up for that. They're really nice regional directors in each region, and they really put out so many resources. The family support guides, like I said, are on our website as well. Each region has their own. Long Island's is probably the biggest. It's like 51 pages or so, but a lot of the other ones are pretty lengthy. We do have our resource page. We do have our event calendar. You can sign up for the email alerts if you haven't gotten any yet. We have the DD council meetings listed on there on our calendar, where it's big meetings with the providers, OPW, DDs, and families all together in meetings discussing all the changes and topics that are coming out.
I wanted to add about the DD council meetings. They are specific to the 5 boroughs, but they do share a lot of information that's still helpful for other regions as well, especially any major updates with OPW DD. If there are changes to funding, there's been an increase in funding for services with the American Rescue Plan Act, so they are a good place to go, even if you pop in for the first half hour or so just to get the updates.
At ACA, we do have a hierarchy that you can follow if you're not getting a hold of your care manager, or you're looking, for somebody, their supervisor or whatnot. Every care manager's email has their supervisor's email listed below it. If you, the care managers assigned directly to you, so their caseload size varies depending on the member tier assignment for each person. Different tiers, I don't know if anybody knows about tiers, but if you're a tier 4, it just means the care manager has to have a face-to-face visit with you monthly, not quarterly. It depends on like your living situation, like a combination of your living situation, if there's medical or behavioral needs, and whatnot. So the care manager's caseload varies by, just by the weight of the tier. But if you need to get a hold of them or their, supervisor, that email, I believe, is on there. Also on their email signature is the customer care center on there, which is a 24/7 phone number. If you have any issues or you're looking for additional information or phone number, you can reach out to them as well. So the assistant director of care manager, who is the person that oversees the care manager, they supervise a team of care managers, and on their email signature will then be their supervisor's signature, who is the regional director of care management. So they're responsible for the regional team. So we have we have 3 vice presidents, but regional directors will have in each region. So there'll be several per region that oversees that. So, don't feel like you're alone. If you ever need to get, in touch with anybody, these are the ways that you can. The vice president of care manager, we do have 3 in total. One oversees Long Island specifically, one oversees the Brooklyn, Queens, and the other oversees the Metro, Lower Hudson Valley, and Staten Island. So the vice presidents of care management, their names, pictures, information is right on our website. At ACA, we do have a lot of support departments for our care managers. Like I said, we have that 24/7 customer care center. It can be reached by phone or email, general questions, or to report an emergency if you cannot reach anybody in that chain of command. We do have that eligibility team, which I said is like, it's our benefit team. So they'll monitor for active and appropriate Medicaid. They'll assist with providing support to our care managers. If families have questions or a more complex situation, they'll be able to help guide the care managers to support you and help navigate your benefits. We do have an health information technology team. They are there to ensure all PHI is secured within our network, and our part of the HIPAA safeguards are in place. We have a staff development team that provides ongoing training and education to all of us on a variety of topics of OPWDD, regulations, program updates, HIT security, you name it, we get trainings on it. We do have registered nurses also on staff. They provide clinical support to the care management teams. They'll present monthly trainings to all of us on a variety of healthcare topics. So they can help support if there's any need like that. Member engagement team creates and develops education and support for our members. They work closely with the Family Advisory Board. They're always reviewing outcomes and advise leadership on improving the care coordination practices. So this is all the behind the scenes stuff that help build up our care managers in the agency. We also have the provider relations that works together with member engagement, helping to build the relationship with the providers out there who are very important to our members, different organizations and advocacy groups to help improve the outcomes for our members. Like we were all at the Special Olympics, who we, partnered with as well. So there's always, great opportunities out there for us. We have a quality assurance team, ensures our care management team are compliant with the regulations from OPWDD and ACA standard operating procedures. Like Pam said earlier, this is our website that has so many great resources, information, our calendar of events. There are health resources, housing resources, family resources. We do have our virtual family forums and workshops each month. So take a look at our calendar, see what's coming up. They'll have the links right on there, the Zoom links, or, sometimes you have to pre-register and sign up for our agency email updates. We don't overload you with updates. They come just, with pertinent information or upcoming forums. And then this is just some of our customer care center phone number, or if you have questions, there's our email and our headquarter address. OPWDD, these are their information, their website. Their website's pretty full and chock full of information if you want to go through that. They do have language interpreter services available as well. So here's some of the links for, and directories for them. And if anybody has any questions.
If anybody has any questions, feel free to unmute yourself. You can use the little raise your hand function, or you can put it in the chat box.
We actually do have one question. I'm going to read it. Would you be able to advise on insurance options in parallel to Medicaid, including the question of whether to pay for Blue Cross Blue Shield through Medicaid or use Medicaid standalone?
Yes, I would say that is possible. That is why we have our lovely eligibility team. So every one of our eligibility coordinators, they help support regional director teams. So they have set teams assigned to them, and they can be called on by the care manager to help with these kinds of questions. It's a great question too, because sometimes, you know, you might look and say somebody's got Medicaid and Medicare, and then they also, you know, a parent is also paying for private insurance through work. In those types of situations, it might be better to not have to pay for that private insurance, to look at an alternative option, and they can kind of tell you, they can let you know what types of plans are compatible with your Medicaid, with your OPWDD services, and all of that.
So I arranged that through the care manager?
That is through the care manager. Yes. So the care manager, if you ever have a question about any kind of benefits, let your care manager know, and you can say, you know, can you reach out to the eligibility coordinator to help me get some advice on this?
Okay. And another question, if I may, you mentioned earlier that some services might be available while we're waiting for the life plan to be finalized and the waiver application to go through.
Yeah, that would be the family support services, where you'd have the family support guide from the region you live in. You're welcome to go through it, call all the, you know, any places you're interested in. What region do you live in?
Very Manhattan.
Okay. Yeah, so we can either send you one or the care manager can send you one. It's right on our website.
No, I've just
And
downloaded
also-
it. Just need
Oh,
to go
good.
You
through.
just did?
Great. And just so everybody knows, after this is over, since everyone pre-registered, I have all of your emails. So I will send you a copy of the presentation so that you have access to all those links and all that information.
Okay.
Let's see, it looks like we have a question from Nancy.
Yeah, when it comes to DayHab and redirection, you could only choose one, or you could do both.
DayHab and self-direction, you can do both things at the same time. So the DayHab service, it does get built into the budget. So with self-direction, everyone gets a budget based on the level of need that they have, and that's where you kind of figure out, with the help of your broker, how you want to, you know, allocate those funds. So you can absolutely do a day program and get self-direction. What they do is they just incorporate that day program information into the budget, and that that budget funds your day program service, essentially.
Oh. Thank you.
You're welcome. Okay. Does anybody else have any questions? I think it sounds like we are pretty set. Okay. All right, I'll let Pam close us out.
Sure. So I did, you know, everyone will get, of course, the presentation. So all our emails will be there. So, you know, we know that this is a lot of information, kind of a lot coming at you. So don't hesitate to email any one of us, and we will try to kind of keep things moving, get information to you. And you have our emails, you know, moving forward. So, you know, really, we're here for you. We're here to support you. All our departments are supporting our care managers. We know it's a lot. It's important to really get onto our emails. So definitely go onto our website and you can sign up for email. So any future forums, any information that comes out to our members, we'll be sending on an email. So just get onto that email address, and you know, that's like a good start for you. So
I also want to mention, on the topic of upcoming forums, we will be having a forum in June that we're going to do something a little different. Usually we present on a topic. We'll usually have some kind of subject matter expert with us. This time, what we're going to do is more of an open forum where you can come with your questions. We will have representatives. We'll have our few care management assistant directors, regional directors. Pamela and I will both be there to answer questions about member engagement. And we're going to have a few other people come in as well. So if you please sign up for the email updates, because we'll be sending out an announcement probably sometime next week for that.
all right. If nobody has any other questions, we will then conclude and end our presentation. We want to again thank everybody for attending. Again, we are here for you. Please email us with any questions. All right, and have a good evening.
Have a good evening, everyone.